or good afternoon, wherever you're viewing in from. Welcome to the Marketplace Reset Program, our health, wellness, and lifestyle, with Linda Dorman as host and co host Yvette Wood.
Good afternoon, everyone. Thanks for joining us today. How are you today, Linda?
I'm doing well. Little scratchy throat today, but I guess that's to be expected when there's lots of things to talk about. That's great. So, little
Yes,
scratchy throat, but I'm here. How about you?
great. I'm doing well, trying to get into the holiday spirit around here. Got one tree done, one to go, whole lot of shopping to do.
Yes, I'm hoping that I still have time to do online shopping and let it arrive to me versus going out to the malls because
Yes.
this 3% in the US of Omicron, I'm just a little nervous about that now. My nervousness around variants kind of waned with the Delta variant, but now it's ticking back up. And on the 19th, I have an appointment for my booster.
Yay.
Take what you said,
That's right.
hydrate. I'm going to prepare to rest, and I'm going to be have an expectation that it could go very, very well, or I could have some side effects, and be okay with that.
At least you're protecting yourself because it was on the news this morning that right here in the DMV, we now have the variant. One of the Washington football team players were tested positive. Um, for the variant for the Omicron. So it is here in the DMV. So if you're here, you live here in DC, Maryland, or Virginia, we urge you to take every precaution necessary because there have been so far 2 deaths reported from the variant. So please, we want you to be careful here on our health.
And it cannot be overstated what those precautions are because we've now lived with it and we've normalized it. And I can tell you how many times I've gotten out of my car and got halfway into a store with eyes peering on me, thinking, "Oh, I must look great today." No, they're looking at me like, "How dare you walk in here without a mask?" Only to realize I don't have my mask on and I have to run back out to the car, and I've got to sanitize as I've touched everything before I put the mask on. And so our habits do change and shift. And I wonder if that's true for others out there. So can you just give us the points around what are those precautions? Even though we've heard them, it's great to get the refresher.
Sure, absolutely. Number one, we know wash your hands, keep your hands clean. I've seen people back at the gas pumps no longer sanitizing, touching the screens on ATM or at the grocery store, putting in your PIN number. Before we were careful, we wore gloves, we were sanitizing between all of that. That's kind of gotten lax. I urge you to straighten up on that one. Keep sanitizing your hands, keep washing your hands. Number one. Number two, wear that mask. Cover up your face and protect your children too. I've seen a lot of children without masks, and these children are still catching COVID. So please wear your mask. I have one. I don't think I have one nearby, but I wear it on my wrist. I keep it on my wrist when I go out. So that way I don't forget it. Because like Linda, I'll get to the door of the store and like, crap, my mask. I mean, sometimes you feel like Batman, right? I got to go get my mask. But you got to wear your mask, everybody. Please wear your mask. And keep your distance. We still need to social distance. I, got an elevator and like 10 people came in. I said, "Excuse me," and I stepped out. We still need to social distance. Remember, no more than 4 people in an elevator, and keep your distance. Your mask, wash your hands, and just be proactive. Try to still have your activities outside. If you're having an activity inside, make sure everyone's fully vaccinated, or even encourage wearing your mask indoors until time to eat at social gatherings.
That is such a good point. Let me just add one more because this is the other thing for our cloth masks. Please wash your masks
Yes.
regularly. We
Yes.
have now a drawer full of masks for each of the family members, and we're constantly throwing them in, washing them, maybe even twice, actually, because in my mind, I'm thinking, ugh, this has been a close to our face. And, then we pull them out and they're ready to go. And before we were using disposable masks more. And even that, make sure you just don't put it on your dashboard when, the mirror, and let it hang down like it's an ornament for your car.
Or an air freshener.
An air freshener. Make sure that you have a box or something in your car that literally you switch out. And I do that almost every time that I get in and out the car when I do remember to do that for sure. But those are great tips. And we may have some more from our guest today as we talk about some things that are very important in the health and safety arena. So you want to introduce our guests?
Absolutely. We have with us nurse extraordinaire Victoria Buggs. She has her master's in public health. She's an RN. She's a nurse educator. She's a CPR instructor. She's a CNA instructor. She's a health and safety expert. She is a COVID advisor. She's a COVID safety instructor. She is in charge of health and safety on her job and in churches. I could go for about another 20 minutes, but I won't because I would be taking away the knowledge that she has to share with you today. So welcome, Victoria Buggs.
Hello, everyone. Thank you for having me, Linda and Yvette. I appreciate the opportunity to get on here today. As you can see, I was trying to move around with the lighting to make sure you all can see me. It's kind of my lighting is not okay.
We can definitely see you, but come back a little bit. There you go. And I can tell you, added to that list, I would say that you are very active in the community as well, because we happen to share an organization in common. And it was such a pleasure to meet you when we did the sickle cell webinar, and just appreciate your work in the Baltimore metropolitan area in this important endeavor. But then also, I just want to add, you've got a great smile. Can you just stand still? Come on, just stand still and give us that flash.
Thank you.
Yeah. Okay.
I just want to make sure everything is okay.
Everything is perfect. There you go. All right.
Thank you.
Yes. So welcome to the program.
Thank you.
And we are glad to have you. And we thank you for taking some time out of your day. Yvette, I know you did a great introduction, and this is a colleague of yours. And so why don't we start out with some thoughts that you have in conversation and questions. And then
absolutely.
I always come with a bunch. So I'm going to try real hard because my throat is so scratchy. I'm going to try real hard not to break it.
I know. I mean, we're going to try to cover the whole gamut of what she does in our remaining 45 minutes. But I want to start, since we were talking about COVID, I want to start and have Victoria share with us her health and safety teachings about COVID and what she has to offer for those people that may be in need of her services.
All right. So good afternoon, everyone. Again, my name is Victoria Buggs. I am the CEO and owner of Center for Health Educators and Safety Specialists. I also have Victoria Buggs Health and Safety Consulting, and both of the businesses are under the same umbrella. However, due to COVID, I was able to birth Victoria Buggs Health and Safety Consulting due to workplace injuries, workplace worker-to-worker COVID transmission, and I was able to travel pretty much throughout COVID-19. So I was able to find ways to protect myself and to stay safe during the pandemic, especially when it was in the heat of the moment during the pandemic. So what I usually do is I'm more focused on workplace safety, because at a point in time we were going into the workplace, and I work for the DOD, and I work with the Surgeon General of my organization. So it was a shock. It was like real shock for when we all had to leave our workplace March of 2020. So I've been in and out of the workplace since March of 2020. I have not been full time back into my organization. However, I began to see things within my organization as well as things in the community which needed to be addressed. And COVID-19, again, Yvette, when I was backstage, I heard that people are no longer washing their hands, wearing gloves, masks. This is really serious. I think the complacency of our community and people believe that we'll just get sick and we'll get over it. Well, if you you rewind back to 2020, half of the year, over 540,000 plus people lost their lives. And I just don't understand how we can continue to be complacent when there are several new variants that have transpired since that point in time. So basically, like you said, again, wash your hands. 20 minutes. I mean, 20 seconds. Wash your hands. Make sure they are washed. Don't go and rush out, especially in public places. Public places, restrooms, bathrooms are getting crowded now. Um, Not to mention the lack of workers, employees. The
Yes.
lack of employees that are no longer working. You can't really find anyone that's willing to work full time anymore due to due to the pandemic or other factors that prohibit them having a full time job. So you already know that some corners may be cut, some
Yes.
costs may be cut, in order to run small businesses and establishments. So, number one, we want to make sure that we do our part. And that's the main message with COVID-19. Do your part. Do your part in staying safe. Do your part in protecting others. If you don't care anything about yourself, do it for somebody else, right? So I bring my own straws. I no longer drink straws from other people where they have to hand me the straw. I put a bag of or box of straws in my bag. I travel. So as when I travel, I use my own personal steel metal straw, right? So I can personally wash it, or I carry a box so I can dispose of those. Again, these are things that I can do within my control. Washing my hands, keeping my mask on, not just one type of mask, a cloth and a disposable mask, right? Because you don't know who you're going to be in contact with. And now we're getting closer to people, right? So everything's a little bit more crowded now in the stores. At the beginning of COVID, you could barely find someone in the store, right? They had a limit, lines outside for you to wait outside
That's right.
to get in the stores. Now everybody is just coming in the stores and around individuals. So again, mask, hand washing, social distancing. What's that? What's social distancing? Do we even know how to do that anymore?
You even look down at those, those feet, those yellow feet, those orange feet. No, we eat. That's a great point. The social distancing.
Yes, so the social distancing, we don't do that anymore, regardless if we're there for a few minutes or 15 minutes. You are putting yourself at risk, right, for contracting or being in close contact with individuals that might be exposed or might have been exposed to COVID, but we don't know, right? Um,
Absolutely.
So
Absolutely. They put you just reminded me of something, Vicky, real quick. The last time I flew, they give you these sanitizer wipes to wipe down your seat and your tray table. People are throwing them in their purses. They're not using them anymore.
mm-mm, mm-mm,
They're not using them anymore on planes. So
no.
please use those sanitizing wipes. You just made me think about that when you said travel. I'm like, oh yeah, they're not doing that anymore either.
Well, one of the things that strikes me is that even with travel, now that we no longer have the middle seat that is empty, so the planes are filling back up again. We no longer have the schools that are virtual. So the kids are back in school. My kids go to a school with 2,900 students, plus the faculty and staff. And so, as they're transferring from class to class, it's impossible to social distance. It's impossible to keep their mask on because the kids now have this thing called run up, grab, and snap your mask.
Mm,
And, it's, things that kids do, teenagers do,
yeah, yeah.
because it's become so normalized that we have so many people who still are not believing it. In your work, Victoria, well, I love that. Vicky, can I call you Vicky? Okay.
Yes.
Vicky. The question I have is, how do you build in strategy? I know that. How do you do your training as well? How do you train for COVID safety procedures and get people really thinking about this from the personal way they handle themselves, particularly in the workplace, so that it becomes policy, and policy that can be enforced through procedures and punitive action if necessary.
Right. So as a nurse, we first thing we do when we come upon a client or a patient, we do assessment, right? We assess our environment. We assess um, the things that we need, the things that we don't have, and the things to make resources to make things better. So first thing is assessment. What do we have? What do we need? What don't we have? What do we need to order? How many people does it take? Can we do with or without? Also in the government, they have a mission, right? Everyone has a mission. But what I realize as a health professional, sometimes health and safety are not put in the mission. It's available in the organization. However, the mission itself is not to enforce safety at a rate that it is for the overall organization's mission. For example, when the organization has a mission to, like the hospitals, they have a mission to provide quality health care to patients, families, advocate on a patient's behalf and stand up to ethics, right? So we know that this is the hospital's mission. Well, in our organization or just any organization, I believe that the mission itself is just it. And we factor in making sure our employees are healthy. We factor in if they're safe because we're regulated, right, by OSHA. We're
Yeah.
regulated by OSHA to do certain things. If you look at CMS and look at their website, see how many organizations are in violation of OSHA, right?
Wow.
Because the lack of providing quality and safe, providing a safe and environment for their employees. So the strategies, again, number one is doing the assessment, having those medical health providers, safety providers sitting at the table with key leaders, decision makers on ways that we can have the workforce, make the workforce more safer to come back to work, right? And if they can't, um, and if they can't come back to work full time, what options do we have?
Yes.
So the options would be teleworking when optional. We encourage our employees to telework, right? And if they can't, alternate work schedules, specifically for the workplace, alternate work schedules. Instead of in-person meetings, maybe you can do free conference call, free conference call, or Microsoft has Teams Meet. You can carry that on your cell phones. Most of individuals with iPhones, they can do FaceTime meetings. It depends on what industry and what organization, whether it be local, state, or federal government. You will have to do an assessment on what options fit the needs of your organization, as well as spreading out. If you have an organization or a department or division with 10 people, kind of section them off. Maybe 3 people on Monday, 3 people on Wednesday, 4 people on Thursday. Section those things off as well. And that'll help us also contact tracing, right? So contact tracing, we'll know who's in the building, what time they were in the building, when was the last time that person was in the building, and just minimizing your footprint as a whole, minimizing the footprint. If individuals have a mission at the workplace where they need to be in the office, strictly allow those individuals to come in. If those other employees does not have a priority mission to be in there at the same time as other individuals, have them come back at another day or speak to them on the phone or some instant messenger just to get things done. Again, social distancing to me is very huge in mitigating or trying to just decrease the spread of COVID-19, right? Also, like I said, I've been in and out of my office since March. The first thing people do when they see you is, hey,
Want to hug you and all that good stuff, and you're like, no, don't do that.
Do that.
Give me an elbow or even a high five in some way.
Yes, and it's understandable because being away from people for a whole year is very traumatic to some social butterflies, right?
Yes.
So just seeing your fellow coworker that you haven't seen in a year, the first thing you want to do is give them a hug. Appreciate you appreciate the human race. You see them, you're like, oh my God, so much death has taken place, and it's glad to see. I'm so glad that you're alive. I'm so glad to see you, and you're like, okay, I'm glad to see you too, but here you go, elbow,
on that. And I don't mean to interrupt. It just dawned on me. You said something really, profound in all that you said that was extremely important, because these are things that we have to just internalize and operationalize.
Yes.
Because this is the new way we're working, and it's working for many. And it's rewriting in certain industries for others. it's certainly putting a spotlight on the importance of healthcare that is mobile and agile, that can flex when you need to flex, that can compress when you need to compress, and that can respond to just a global pandemic that hopefully in the next 100 years there won't be another one, because we would have really taken some formative steps, policy and medical technology wise. But one of the things that you just said that brought it down to really the human side of it is sometimes that isolation, we need a hug. Are we saying that that human touch could become our death sentence? Is there any safe way that we can? Because I know that isolation has been just so traumatic for those who have never had the level of isolation that they've had over the last 2 years. And coming out, going to the grocery store, going to the movies,
Yes.
even, which we are able to go with full seats, by
Yes.
the way, which is shocking to me. And of course, you're eating your popcorn and all that good stuff. So obviously, I've been to the movies at least twice in the last 2 years. But I'm just trying to figure out what's our degree of having a little bit step over the line while we are still maintaining safety. Are we just, is that a pie in the sky thought?
No, well, staying connected is not the number one thing I would encourage. Staying connected. If you can't see a person physically, try to contact them via FaceTime, Zoom. A lot of people are zoomed out. Like I'm zoomed out. We have Zoom for meetings. We have Zoom for every little thing, church and this and that. So I think outside, what I did before COVID was let up. I'm a COVID lab, so not a COVID lab, but a clear lab. So I'm able to COVID test. So I was able to bring some friends over after they got COVID tested. Like, hey, you can come over. I need to see your COVID test prior to you coming, because I have some pre-existing health issues as well, respiratory issues. So I don't want to take that for granted just because I trust you as a friend or a family member. So it's different ways without being offensive. If you have friends that are willing to have COVID tests prior to being in your presence, I would advise them to get one. If you're vaccinated. Now, we all know the controversy of vaccinations, right?
Mhm.
So I'm going to tread lightly on this line.
Well,
So
speak your truth, though. Speak your truth.
Yes, you can. I mean,
so COVID.
our audience wants to learn.
So the vaccine is a preventable measure for individuals to possibly not die of COVID, right? It's not saying that we couldn't get it, but it's a prevention measure. And the ingredients in the vaccination is unknown, right? So I'm prior military. I retired from the military, went in at 18 years old, retired at 38. But I remember when I enlisted in the military, I had to roll both sleeves up, and I walked in a line on both sides, and I got injected on both arms. Never did I question what they were giving me. Never did I ask a question. I was told that these immunizations will prevent me from any harmful disease that I might encounter via stateside or overseas. And right there in my mind, I had no questions about it. If it's protecting me and it's going to save my life as I travel overseas with anthrax and things of that nature, which is one of 4 series of immunization. So I never questioned it. So it was okay for me to raise my sleeves up and my arms out when it was time to get the COVID vaccination. Everyone's not like me, right? And educating and encouraging our community on why it's so important. And I'm speaking particularly about the African American community, because so much has happened in the history of research and medical care for African Americans. So they're hesitant on providing their arm for, trusting. They're not trustworthy. And it's up to us healthcare providers, family members, to encourage them to do so. So that's what I'm going to do on say about the vaccination.
I know we have to take a break, but we have 1 minute left. What I did at my family reunion this year, Linda and Vicky, I instituted the rubber bracelets, and I had red, green, and yellow. And if the older seniors, we put the red bracelet on, which means do not hug them. We put the yellow bracelet on those, was like, well, you can come close and talk to me. And the green light was like, I'm fully vaccinated. Give me my hug. I want to be close to you. Let's do this. And it worked really well. No one got sick. So there are ways that you can socialize and not fear death, so to speak. But then there are ways you can socialize, and you need to fear death if you watch some of these football games. But I'm going to let our executive director Linda take us to break. Okay, well, we're going to take a quick station break and come back talking to Victoria Buggs, who's given us a world of information around how to maintain our safety in and around the COVID in facilities. And we're going to have more conversation right after the break. And so we thank you, and we look forward to having the next round of conversation. It's going to be good. Stay tuned.
I'm setting an example for my kids.
I got me a side hustle.
I have more control of my destiny.
I need multiple streams of income.
It's hard work, but I'm working for me.
A job is cool, but I need more.
It's all about being self-employed. You're tuned into the world of Self-Employed and Rising with Art Taylor, where we bring you the amazing stories of people who are challenging the odds and following their dreams of self-employment. Learn from their successes and be inspired. Hear creative ideas for your business and find tips to take your hustle to another level.
Style takes too long. I can't fit anything. I have nothing in this closet. Oh, I'll just stay home. I need to purge my closet. Oh, but not that dress. Yo, Taylor here. If you ever thought to say one of these phrases, then this show is for you. Join me at the Style Table, where we'll have candid and fun conversations about real women's style issues and wardrobe dilemmas. We will discuss solutions and ideas that will give you a big sigh of relief. You'll learn ways to save money, make money, and enrich the lives of others with the clothes in your closet. We're going to take the stress out of your style.
Hello, and welcome to Behind the Inspiration Podcast, the show that encourages and motivates with our 5-minute interviews of inspiration. My name is Ken Waller, and I am your host. The Behind the Inspiration Podcast is a part of my moving forward by helping others identify what true inspiration is. Behind the Inspiration Podcast was developed to provide a platform for sharing awesome, uplifting stories by individuals inspired by events or situational experiences in their lives. You know, inspiration motivates you to be better and to do better. Different things inspire different people. There is so much inspiration in this world. It's important that we start to highlight the things that inspire us versus the things that are destroying us. The Bahani Inspiration Podcast can be heard right here on Anchor Podcast or on the podcast platform of your choice. Thank you in advance for tuning in.
Ooh, you caught me trying to get on my eye there. I mean, I'm telling you, well, welcome back to the Marketplace Reset Program, our health, wellness, and lifestyle channel on our Health TV network, with broadcasts on Roku. And we're excited to have as our guest today, Miss Victoria Buggs, who's a registered nurse, as well as the CEO of her own company, and we applaud her for that. But I'm going to also just say thank you for your service to our country as a woman veteran.
Thank
So
you.
that's very exciting. You were brilliant and smart, Victoria. 18, and you said you retired at 38. Oh, good grief. Well, we appreciate your service. That's a fine
Thank you.
number of years, and we thank you. And you said something really important right before we took the break, and that was that you walked down the line, sleeves up on the left, sleeves up on the right, and had your vaccination in both arms and kept on going. And so that just brings to mind there are many veterans across this country who might be hesitating to get their vaccine. And that's a great reminder that they had trust then. Never
Yes.
question orders, never question, and we're safe along the way. And we're still in that posture today. So we
Yes.
hope that you've heard the call from one of your fellow veterans, and that if you're not vaccinated or you don't have your booster, you're still hesitant, then here's a voice of reason that just shared with you a previous experience, because I'm sure they all had the same experience.
Yes.
Okay. They all had the same experience. And so we encourage you. So Yvette, I know you've got some thoughts and some questions. I promised that I wasn't going to say much, but I get so excited. I can't help myself.
Absolutely. Victoria just has so many facets to what she does. I'm just going to piggyback on that, getting injections in both arms really quick. This past Sunday, I was at the school. I had to take my little one to get her first COVID booster. And so you had all these kids in the gym, and they walked in, and it almost takes a childlike mentality. They told them, you go to table 1, you go here, you go here. And as soon as they sat down, she said, roll up your sleeve, pull your arm out. And these nurses were not arguing with these children. They weren't listening to the parent. They took that alcohol, and before you could say anything, these children were injected and was told to go sit down for 15, 20 minutes. And that's what it takes, almost a childlike mentality to get this done. And from the littlest ones, from the 5 to the 8-year-olds, they were just getting these shots. And just move along now. We're not here to discuss this with you. Your parents brought you here. You're going to get this done.
Absolutely.
And I was so proud because none of them cried. I was waiting on the yell and the scream, but the kids kind of like took their shot and got their little sticker and they went dancing off. I wish it took a sticker to make us happy, right?
Absolutely.
The pandemic youth of today, I think that they have processed this, and certainly my daughters have become my heroes because they took it in stride. Usually they would be crying and crawling up the wall. And guess what? They're 15 and 16. So we're still there with a little concern. You one of the things that you also train in, and I'm a former Girl Scout mom and I'm a Girl Scout mom and former Girl Scout leader, and that is in CPR.
Yes.
We still need that. We
Absolutely.
still need training. Can you share with us the importance of all of us having our CPR card as JQ public citizen that can help in a time of an emergency?
Yes. So now everyone needs to be certified in CPR. However, I believe that everyone needs to learn the basic skill of performing CPR. You never know when you'll need the skill set, right? It could be during the holidays. When someone's choking, or you couldn't get it out, they become unconscious. What are we going to do? Oftentimes, or not, we run to the phone and call 911 while we could be rendering assistance at that very moment, right? So I believe that everyone should learn CPR. You don't have to be certified in it, but just take the time out to learn the skill set as well as refresh on it often, because it could be your husband in bed with you, or your wife. It could be your kid. It could be any person that you love, or stranger, as well as a family member, your grandparents. The older we get, we're people can not swallow as fast, or I'm
Or
trying
have
to
the reflex. I remember when my
reflex,
mother
right?
lost the reflex of
Absolutely.
swallowing,
Yes.
and we had to be we could not do solid foods at some point, and she had swallow therapy. But is it true that we can also help ourselves? There's some techniques in CPR that we can actually. Oh, okay, because I remember taking that training, but I have to admit it's been a while.
So,
Um,
really, really quick, I wanted to go back to the hands-only CPR before we move on to the skill set. A lot of people are hesitant, hands offish, because of the compressions and mouth to mouth, right? I don't know this person. I'm not going to put my mouth on this person because of the fact that I don't know him. It's a stranger. So, American Heart Association and all of the nationally recognized organizations have implemented the hands only CPR, that you can continue to do compressions instead of giving the two breaths. So if you're hesitant, continue to provide compressions
mhm.
um, to ensure that the blood volume increases to get throughout to the brain and throughout the rest of the body.
So is it the oxygen in the blood
Yes, ma'am.
that's pumping to do
Hmm.
what the two breaths
Yes,
used to
17
do?
to 21% of oxygen is in the blood.
Uh-oh, wait a minute. I was talking. Give us
I
that
said 17 to 21% of the
17
oxygen.
to 20%. That's
Yes,
fascinating. Okay. And so that's the new standard, is to just continue the hand
compressions.
compressions right under the breastbone to keep the heart pumping versus
Goes in the center of the chest, not on the edge of the breastbone. So remember, the center of the chest.
center of the
A lot
chest.
of Yes, and also the hesitation is that a lot of people think they will injure the unconscious person, as far as breaking a bone, you cracking their ribs. Well, the advice that I give individuals is you can crack a rib and you can get that prepared. You cannot bring a life back once it's gone.
Oh,
Absolutely. And when you're choking, never, ever, ever go into the bathroom in a restaurant by yourself. So often we get embarrassed because we're choking and people are staring, and you see people get up and they run to the bathroom. That is the biggest no there is. Stay where somebody can help you, please.
And speaking of that, Yvette, is that now it's COVID, right? You cough in a restaurant, everybody.
they're running to the bathroom and you're left in the
Yes, that's
hall. Yes,
true.
yes.
So that was good advice, because even though you're in a restaurant, no mask on, COVID, and somebody coughs, everybody's looking like, who did that? No, we need to literally stay focused, make sure that person is okay, can speak to us, because again, you're not choking if you're talking to me. You're not choking if it went down the wrong pipe, right? You're only choking if you cannot respond to me when I ask you if you're okay.
Mhm.
Right. So if you're choking and you're saying I'm good, I would encourage you just to keep coughing to clear your throat. But if you can't keep coughing and clear your throat, immediately we need to seek emergency services.
And is the coughing that you can add, you can help yourself cough even harder. That's the body's reflex in trying to clear its own airway. Is that how?
Yes, or yourself. You know, you want to get it out, but you can still talk like, oh, because we can feel that tingling and that distress in our throats. But if you could keep on talking, say if I was coughing from drinking something and went down the wrong pipe, and you asked me, Vicky, are you okay? And I go, yeah, it just went down the wrong pipe. Encouraged to call, because I can talk to you. I'm not choking. I'm responding to you.
Right.
Most people, individuals that are choking will not respond to you. And they will give you the universal choking sign that I can't respond.
Oh, okay.
Absolutely. And that can be so frightening.
That can be very frightening. Yvette, you mentioned something about don't do that. Do not run. Do not isolate yourself somewhere and try to help yourself, get that support and help that you need. Are there other do not do? Like we learned, don't hit somebody from the back if they're choking. Is that still, because I see that all the time? Like, oh, it's okay. Here, we're just trying to help clear it, I suppose. Is that a no-no or is that okay?
Actually, it's both. Depending on if it's an adult, it's usually a no-no. Because if it's something that's lodged, you can further lodge it by hitting them. With infants, they encourage you to still do the back blows with the infants. Because you have a baby, you can, put them over your wrist and you can push up and do the back blows and dislodge it. But with adults, sometimes we found that we were making it worse, where it wasn't really stuck. They could have coughed hard enough, but then we run over thinking we're saving them and we hit them and the reflex and it gets stuck for real. Wow. So you have to kind of use wisdom. It's a lot. Always call 911 first or have, instruct someone to call 911 while you're working with that person. I encourage people, like I said, not to go off by yourself, because I saw it. I was in a restaurant and this woman, she was choking and she got up from her seat and ran to the bathroom. We were in Longhorns. And I said, that woman's choking, because she was starting to turn colors. And I happened to go in there. There was nobody in there but her. So what if nobody went in there for 15 minutes? She would have been laying in there on the floor. Because she said, thank you for helping me. I was so embarrassed. I said, yeah, but don't be embarrassed enough to die. Stay where somebody can help you, where somebody can see you and call for help. Because no one would have known you were in here, sweetie, if I hadn't got up and come in here. I just happened to be paying attention. And like Vicky was saying, right now you cough, everybody's looking. So you got everybody's attention right now. So stay there. Somebody prayerfully will help you and not pull out a cell phone. That's another problem we have in society. We want to video things instead of responding. It's like, what is going on with that?
That is the truth. And that's a very interesting behavior, don't you think? I don't know what that psyche, why people want to record those kind of events instead of stepping in. And I guess that's what they feel that they can do. And maybe that's the reason. We don't know. But if you're by yourself, what is there anything that our individual who's at home by themselves can do if they start to feel that, like, oop, I'm starting to choke and their body is beginning to respond and react? Can they hit themselves on the table or give themselves the Heimlich maneuver? Or
it's a chair, so they have
a throat, or I don't want to be, make a joke of it. I'm just trying to figure out, is there anything that they can do besides try to hit an alarm of some sort that may or may not be in their home?
Well, so what I teach is those individuals that are by themselves and they begin to choke. If you have a high back chair, chair that's high back, and you can bend over it, you begin to thrust your body on the back of the chair forcefully and pray that will give you some relief. If not, always, if you have a alarm, hit that alarm to notify the police or somebody like that. I'm not going to tell you how to go run next to your neighbor or anything like that, but through AHA, American Heart Association, we're taught to do a chair thrust. Continue to cough if you can. If you can't, hopefully somebody will be there to help you. I have on my alarm, I can activate the police. I can activate the fire department. Hopefully they will come in time.
Absolutely. And one of the things that I do, ladies, since you are both ladies, I know that Victoria has that strong husband, protective of her. He just adores his wife, but Linda and I are single. So one of the things that I do is well, excuse me, maybe not, but she was. So not for long. I use my cell phone. And so whenever I'm by myself, it's always on 911. So all I have to do is hit one and send. So if in case of an emergency, all I got to do is hit those two things. So if I'm choking, I can just hit that one and send. Whenever I'm out or about, if it's late at night and I'm driving in the car and I'm not, it's always set to that 9-1. I have to add just one and send.
Okay,
so it's
cool.
just Yvette's personal tidbit for safety when you're by yourself.
That is a brilliant, in terms of how to use our technology to support us in any safety environment, whether it's choking or whether we're alone driving or whether we're walking down the street and it's late at night, just to have some measure of ability to call authorities to support and to help you, particularly if you're almost incapacitated as you might be in choking. Do you find that who's more responsive to this? Is it children? Is it teenagers? Is it elderly? Who's our star pupil in your classes that we need to really pay attention to? My daughters, as an example, are constantly reminding me it's time to change the batteries in the fire alarms, smoke detectors. And I'm saying, but it hasn't started beeping yet. That's my signal. So let's just let them run out and let's save a few dollars on some batteries. And they have been conditioned and trained through the school system. No, that's not the right response. So they have starting to, they've been conditioning me over the last couple of years, particularly during COVID, because it did run out a couple of times. And so that was my credibility was lost for sure at that point. But is there a star pupil? Do you find in a particular group that's more responsive to the training?
Well, most of the time it's the adults, right? Because they need it for their jobs, for employment, or the grandparents or child care providers that are watching grandchildren who, their children are like 40, 50, and they got this newborn that they're going to be watching. So they are very excited and they want to learn, and they want to be safe with their grandchild. But first, I want to applaud your daughters, your children, in knowing that, hey, we need to provide maintenance. We need to do, preventive maintenance on the alarms, making sure the batteries are done, making sure we know when the last time the batteries were changed. So in my health and safety business, that's what I do. I develop plans. I create health and safety plans for the household, for small businesses, nonprofits, large enterprises as well. So being at home, we often lack plans at our houses, at our homes. We often lack some type of safety structure. I asked a group of people the other day, how many of us have fire extinguishers in our kitchen?
That's absolutely right.
I'm going to say I know that I have one, and then I checked it and it was not on the little green. It was on empty. I did not even realize that they can deplete if I didn't actually deplete it for a fire. So I don't even know what happens. I guess it just fizzes away inside.
Yes.
And so, yeah, I have one. I had to replace it because there was nothing in it. So
Absolutely.
it's a false sense of security.
Yes. And not just that, Linda, what if?
That's true. And it happens.
That'll help you.
It happens.
I would have turned it on and it would have gone and nothing would have happened. And I'd be really in that what if moment when I thought that I was secure. So your point is extremely well taken. I actually decided to go a little bit, kind of crazy. I put one on every single level of my home in case there was an electrical fire or something else. And we needed to do that. You mentioned, Victoria, to have a home safety plan.
Yes.
And do you work with individuals? How can individuals get a hold of you if they want to better understand how to develop a home safety plan? Like, what exactly is a home safety plan? It sounds intuitive, like we should know it, but we don't want to make an assumption that individuals really get the detail of what a home safety plan is.
So a home safety plan, it comprises of your fire extinguisher, your exit plan, just in case something happens in your house, your medication plan, that you have medication with young children. Say you're let me see how I can put this, immobile, right? And you need to have your medication by you. However, you're not always coherent uh, with your medication. So having a safety plan on that, and it comprises of everything in your house to make everything safe.
Yeah,
Make it
especially in the event of a break-in. Don't
in a
forget that one,
break-in,
because
yes.
if you put your children on the first floor and you're all the way up on the third floor and an intruder comes in on the second floor, what are you going to do? What is your plan of action?
Yes. So
She does it all.
yes, I have a safety plan for my children. So my kids know where to go just in case of an invasion, what to do, and where the rally point is at. So this is a home safety plan from a fire plan, a pharmaceutical plan, your pharmacies, your drugs, whether it be narcotics, aspirins, just any over the counter drug that you have. You have young kids nowadays, they can mix all these over-the-counter drugs and make a big concoction
Wow.
of whatever, and it's very dangerous.
Yes.
So also home invasions, locking up, using safety precautions as you exit. You go on vacation and leave your house, things that only your family members know, as well as someone that you trust, right? Because if something happens to you, what's next, right? Where are the documentation? Where is the key to this? Where are the keys to that? So also appointing individuals to do things on your behalf. So that is the home safety plan.
Right.
If
And
Linda's down
passwords. She taught me about passwords. She said, have your password somewhere that people can access them. If your plan is in your computer or something like that, they need to access bank accounts and things like that. Have your passwords in a safe place.
Yep, in a safe place. And even for small businesses, as myself, I'm a single sole member of my business. So if something happens to me, how is someone going to get in here? How is somebody going to get in my organization? Where are the keys at? So we develop plans like that, infection control. If something happens to me or something happens in my organization with blood, because I also provide immunizations here. So what if something happens in here, or something that happens to me? What plans will we put into action?
Well, we want to tell everybody how they can get a hold of you.
Yes.
We want to support your business, and we want to make sure that people know, because this is very practical, great information. And we all need a home safety, and we need a written home safety plan. And it doesn't just include your health, it includes your finances, it includes your technology, it includes your property. And, you said something, because as you were talking, I was thinking about all the people who lost their lives in the recent, tornadoes that just washed through the Midwest, and just so many individuals, and wondering what was their safety plan, if any, because they live in a part of the country that is prone to that. And so how can our listeners and viewers get a hold of you, Victoria?
So my name is Victoria Books. You can reach me at Center for Health. Well, it's CTR4HESS.com. That's my website. And I can also be reached at CTR4HESS@gmail.com. If you want to reach me telephonically, it's 410-567-2020.
Awesome.
And we didn't get to really get into it, but she mentioned that she was CLIA certified. She's a lab to test for COVID.
Yes.
So that's very critical, especially right now. So if you need those kind of services, please reach out to her. She's wonderful. It's funny because I'm in the middle and I've been trying to plug these two together like this, and now I have them plugged in. It took this interview, so I'm like, okay.
Yes.
They're trying to plug them. So God is good.
Yes, He is.
We're plugged in because Victoria, you have given us some remarkable food for thought with your beautiful smile. I'm just going to keep saying it. You have such a great smile. And we have a few more minutes, and I just want to quickly ask, and then I want to leave the last set of questions for Yvette, because I'm always interested in the passion that you bring, and you certainly bring a lot of passion. Was this what you did for the United States military? Were you an RN
So that's funny. So I joined the military as administrative assistant, which was a 71 Lima. Then I switched to human resources. But during that time, I have a lot of healthcare providers, nurses, CNAs in my family. And I told my aunt that I wanted to be a medical assistant. And she said, "You want to be a medical assistant?" And I was like, "Yeah, I want to be a medical assistant." I just moved to Maryland and I was going to Anne Arundel Community College. And she said, "You need to become a nurse." So I was like, "Okay, well, let me switch my major." And lo and behold, this is like so predestined. I got a MILPER message, which is a military personnel message stating that any career field can become a registered nurse if they were able to get their degree in 2 years. So I was afforded the opportunity through the military to find a college that would accept me for 2 years so I can complete my bachelor's in nursing. And I did that, and I went to Howard University, and out here in DC, and I completed my bachelor's degree in nursing December 9th of 2009. So it made 12 years for me.
Yeah.
All right. Yay. Well, I'm just going to take this last 30 seconds I have and say, I have the privilege of working with Victoria on Sundays. We keep the house of God safe, and you can, if she says she's going to do it, she's going to do it, and it's done right. So I encourage you to reach out to her for any of her services. I don't say that lightly because that's my integrity as well. But this is one person who does exactly what they say they're going to do, and she does it well. So thank you so much for talking to us today. I've been hounding her for months to get on here and share. She's just so busy and in such demand. But thank you so much, Victoria, and I'll see you Saturday.
Thank you. Thank you all for hosting me, having me. It's an awesome opportunity, and I am so grateful for the opportunity.
So just plan to come back in the new year and give us an update on how things are going and more good information that we need.
Thank you.
Thank you.
So we're going to look forward to next week's program, and we're going to close out today and wish you all a great holiday. As you go shopping, stay safe. Remember all the tips that you learned today on today's program and building your home safety plan and keeping yourself safe. Have a great afternoon. Ladies.
Thank you.